presentation on the children. Hello and welcome to today's presentation on the Children's Health and Behavioral Health Systems Transformation in New York State. This presentation is intended for family members, caregivers, and young people who might have some changes happening in their health and behavioral health system and services, and to help orient you to those changes. This effort is a 5-agency effort that includes the Department of Health, the Office of Mental Health, the Office of Alcoholism and Substance Abuse Services, the Office of Children and Family Services, and the Office for People with Developmental Disabilities. We're going to be talking about a number of topics today, one of which includes the changes to the Medicaid program for children. We're going to be going over the vision for what these changes are intended to have for children's Medicaid system. We're going to be talking about some new services that are available to children and families called Children and Family Treatment and Support Services. We're going to be talking about the Children's Health Home Care Management Program and how it fits within the new services array. And we're also going to be talking about the Children's Waiver, which are home and community-based services available for children. We're also going to be talking about the New York State Children's Medicaid Managed Care System and the basics of Medicaid Managed Care, and what HCBS children, that's home and community-based services, and families need to know about the move of the HCBS services into managed care. So first, let's start with what brought us here today and all the changes that are occurring within the system. So it all began back in 2011 when the governor of New York State, Governor Andrew Cuomo, decided that the Medicaid system needed some changes to make it more efficient, more effective, and have more quality for those in the system. As a result, a Medicaid team was convened of people involved in the child serving system and the state agencies who serve them to discuss how best we can change the system to better meet the needs of children and families. So at that time, stakeholders came together and identified the ways in which the system might be improved to better serve children and families. And they identified a number of different things that they wanted to achieve through the Medicaid managed care redesign. First of all, they wanted to make sure that children and families were getting their services earlier, and that they were able to receive services as soon as a problem or a concern was identified in a children and a youth. They also wanted to make sure that families and youth were the ones guiding the services that were being provided and the care management that they were receiving. They also wanted to make sure that children and families would get these services earlier so that they would avoid needing higher level services such as hospitals or residential services, and they were going to be able to receive services in their communities and in their homes to better support them and to make them more successful. They also wanted to focus on building resilience and recovery for young children and for young adults. So the state agency partners and the stakeholders identified a number of new services and ways in which the system could better meet those needs. Therefore, new services were created so that they were available to more children who were in the Medicaid program. They also identified services that would be able to be provided in the home and in the community, and not just in office settings or in high-end settings such as hospitals or residential settings. They also wanted to make services available to a wider range of young people, starting at the age of birth to 21. In addition, they wanted to make sure that all of this was covered under Medicaid managed care so that there were more service options for kids in managed care programs. So we're first going to talk about some of the new services that were an outgrowth of this redesign effort with the state agencies and the stakeholders. They're called the Children and Family Treatment and Support Services. So what are these services? These are new services that have been created as a result of the Medicaid redesign. They're focused on addressing the mental health or substance use needs of young people in New York State who are in receipt of Medicaid. They are available to young people from the age of birth to their 21st birthday, and they're for anybody who is in or eligible for Medicaid. These services are really intended to be provided to families and young people in their homes and in the community, or wherever really children and youth and their families feel most comfortable or feel the services would benefit them most. There are 4 services that are now available under the Children and Family Treatment and Support Services. The services are known as Other Licensed Practitioner Services. These are treatment services that are provided to children and families, like you may get in a clinic, but that now are available in the home and the community. Community psychiatric supports and treatment are other support services that really help to address the interpersonal relationships between families or the young person and maybe their friends or their peers. It also helps to address the needs of a child and family if they're in crisis or in dire need of additional supports. Psychosocial rehabilitation is really helping young people to relearn skills and help support them in their home and community by assuring that they have the supports necessary to address their mental health or substance use needs. And family peer support services, which began in July 1st of 2019, are available to really help young people and particularly their caregivers in supporting the young person in dealing with their mental health or substance use needs. And their peer is provided by an individual with their own lived experience, who they themselves have been a caretaker or a parent of a young person with mental health or substance use needs. So how might somebody be able to get these services? These are new services, and we're working for them to be available statewide. So you can ask one of your current healthcare providers how you might be able to get these services or how they can connect you to these services. You can call and contact your Medicaid managed care plan and find out who are the service providers in your area that you might be able to access these services from. If you're enrolled in a health home program and you have a health home care manager, you can ask them about finding these services. Or you can also talk to your local county, such as your Department of Mental Health or your single point of access, your SPOA, or your local Department of Social Services to find out about these services. In order to get these services, you may need a recommendation from a licensed practitioner, such as a social worker or your primary care physician. A recommendation works like a prescription, and you can get one from one of your licensed practitioners. And they can help identify if your child might be eligible for CFTSS services. So as I mentioned, there are a number of services that are available, some of which are being phased in over time. Some are available right now, including, as I mentioned, Other Licensed Practitioner, Community Psychiatric Supports and Treatment, Psychosocial Rehabilitation, and now Family Peer Support Services. And in January of 2020, 2 new services will become available under Children and Family Treatment and Support Services, again, CFTSS, Youth Peer Support and Training, and Crisis Intervention. These services right now are available under the Children's Waiver, but they soon will be available under CFTSS starting January of next year. So to find out more about the Children's Waiver, I'm going to turn it over to my colleague from the Department of Health.
Great, thank you, Meredith. Hi, everybody. My name is Colette Pullen with the Department of Health, and I would like to share today some of the new services that we have gone live with, as well as health home care management that Meredith has already spoken about. So the first thing we're going to tackle is the new Children's Waiver, which is what Meredith has already mentioned, the home and community-based waiver. And previous to April 1 of 2019, there was already 6 waivers that were in place. So many of you may be aware of that or even received services or still receiving services from a waiver previously. So OMH, the Office of Mental Health, had a mental health SED waiver. The Department of Health had what we called the Care at Home 1 and 2 waiver, which was for children who are medically frail and had medical issues. OPWDD is the Office of Persons with Developmental Disability, also had a Care at Home program for children that had a developmental disability as well as a medical condition or medically frail. And then the Office of Children and Family Services actually had 3 waivers, one SED, which matches the OMH waiver. They had a developmental disability waiver for children in foster care, and also they had a care at home medically fragile children's waiver. And next slide. These 6 waivers were all combined into one waiver program. Our goal here is to make sure that, as Meredith mentioned, the vision is to have families and youth and children be able to access services in a more streamlined manner. And to do that, we combine these 6 waivers into one waiver called the Children's Waiver for these home and community-based services, so that there was really no wrong door when children and families needed services. It didn't matter what state agency or program you went to. If you needed these types of services, then someone could assist you in getting these services. And this began on April 1st of 2019. So what are home and community-based services? So they're a little different than the CFTSS services that Meredith just mentioned. These services are for children and youth who have complex health and mental health needs, and is to assist those children to help them stay out of hospitals and residential settings, or to assist those children who are already in hospital or residential settings to be able to return home safely with these wraparound services. So our goal is really, just like the title of home and community-based services, to provide services in the home or within the child and family's community so that they can be successful and stay within their home and community. So that's really the goal. Also, to allow some flexibility in the services to really, as Meredith also mentioned, intervene earlier to build upon strengths and build skills, so that children won't have to go into the hospital or a residential setting. And the goal around those strength building is what we call the 360 approach, looking at all the needs of the child in the health, mental health, and or developmental needs of the child. So that is the goal of home and community-based services. So who can get these services? Well, these are Medicaid services. So any child who is enrolled in Medicaid or who might also be eligible for Medicaid can receive these services. So there are some children that may currently not be eligible for Medicaid, and if they need these services, and if they are in a hospital or residential setting, or maybe at risk of going into a hospital or residential setting, they may be able to get on Medicaid to receive these home and community-based services. And we have a process for those children who do not currently have Medicaid and would need to get some assistance to receive these services, as well as to get on Medicaid. And how they would do that is they would be referred to CES, and on the next couple slides it does talk about this Children, Youth, and Evaluation Services, and that's the phone number, and that's what CES stands for. So again, any child who needs extra care in their home and community to avoid those long-term inpatient stays or residential programming, or that may go into higher levels of care, or for those children who are already in those types of settings and would like to return home, these are the services that would be provided to them. So on this slide, as you can see, there's quite an array of services. We have a number of brochures and other materials that are on this website, along with this PowerPoint that breaks down each of the services, what type of provider will provide those services, as well as what the need of the child would be that these services would be beneficial for. And as Meredith had mentioned, the family peer support is effective in July, and then the two other services are effective in January 2020, the youth peer support and training and the crisis intervention. Now, any child who is receiving home and community-based services or are found eligible for home and community-based services can receive any of these services as long as they have the need to and they meet the eligibility. And they can even receive the youth peer support and training and the crisis intervention until it gets moved to CFTSS, as Meredith had mentioned. So the overall goal, as I mentioned, for home and community-based services is to provide these services to those high-risk youth and children, and to really provide a safe environment for them to stay in their home and community. So the next thing I want to talk about is health home care management. So this is a lot of information, and we've kind of broken it down into buckets. So I just want to say that the CFTSS services that Meredith went over is a set of services based on needs of children, and then the home and community-based services are also a set of services to be delivered based on the needs of children. And health home care management is just a little different. Health home care management is to assist children and families with coordinating services. So the service they're providing is care coordination. The first piece, because we just talked about home and community-based services, is when a child receives home and community-based services through the children's waiver, it is a requirement or a need that they have to have some type of care coordination, care management. So we have linked health home care management, care coordination to home and community-based services. So children who are already receiving Medicaid and then become eligible for home and community-based services will receive health home care management unless they choose to opt out. So if a child does not want health home care management, then they will be referred to the Children and Youth Evaluation Services, because as I mentioned in that first bullet, you cannot receive home and community-based services without having some type of care coordination. So that is either through Health Home or through CS. Now, what is care management in general? So the first thing is Health Home is not a place or a location. It's an actual service, as I said. It's a service intended to help children with complex and behavioral health needs, and it's to help coordinate their services, because we know that many children that have high needs or have complex health and behavioral health needs may have multiple providers or multiple services, and sometimes it's hard to maneuver through all these systems. So care coordination is to coordinate the children's services, also find the right service to meet your child's need. They can assist you with that. And then they will also assist with identifying whether or not your child is eligible to receive home and community-based services. They will be the actual people that will do that assessment to determine your eligibility. And whether that's through a health home or CS, these are the goals of that care coordination. Now, also, the next thing that has to happen once you're found eligible for health home care management and or HCBS is you need to have a plan of care developed. So a plan of care outlines all your goals and your needs and the services that you and your family want for your child, and it's written down on what we call this plan of care, and it's shared with all the providers so that everybody's working together for your family and for your child, and everybody's talking to one another so that there's no miscommunication and everybody's trying to help and make sure that you're getting your needs for your child met. Now, there is an eligibility for health home. So just for health home services, you need to have 2 or more what we call chronic or ongoing health conditions, or you can have what's called a single qualifying condition. Or, as we mentioned, you could be eligible for the home and community-based waiver. So an individual child could receive just health home care management by itself because they have ongoing health conditions or behavioral health needs. If they're at risk of hospitalization or already in a hospital and want to come home, then they may also be eligible for home and community-based services that will be managed or coordinated by either CS or health home care management. So how do you find out if your child is eligible for care management or for HCBS? Well, that's really simple. You just need to get a referral. You yourselves as a parent can make a referral. You can ask your health care provider. If you're already involved with a school or community provider, you can ask them. Many of you who are already on managed care may already have a managed care plan, and you can talk with your plan about your child's needs, and they can connect you to a health home or CS or whatever you would like. So there's lots of options. We have at the end of this presentation a lot of different phone numbers and ways that you can get connected that someone can assist you. So I just want to talk a little bit about CES, as I just mentioned. So the great thing about home and community-based services is you don't already have to have Medicaid. If you already have Medicaid, you can get connected right away to a health home who can determine whether or not you're eligible for home and community-based services and get that ball rolling. If you're not in, your child's not in Medicaid right now, but you have some concerns, behavioral health or mental health concerns with your child, maybe your child has been in a residential setting, or maybe they've been in and out of the hospital, and you would like these services, then you can refer yourself, or someone can refer you to CS, and they will assist in determining whether or not your child meets eligibility for HCBS, and then they will assist your family in applying with the application to Medicaid to get you enrolled in those services. And then once you're in Medicaid and you're eligible for HCBS, you still have a choice whether you want to stay with CS or if you want health home care management. So you have lots of choices along the way that your care manager, CS, your managed care plan, and others can explain to you. As I mentioned, here are the phone numbers and the for CS, so you can make that referral yourself. On the next slide is a way that you can contact and find a health home. So if you're already in Medicaid, you can contact a health home. We have a website there. You can pick your county and you can see your health home. If you don't have the ability to go on that link, you can call that phone number there at the Department of Health, and we can assist you. Many counties have multiple health homes. The other thing you can do is if you're already working with a provider in your community, you can ask them if they are a health home care management agency, because they may also do that, and you could work and stay consistent with the same agency you're already working with. And as I mentioned, if your child doesn't have Medicaid at this time, but you would really like HCBS services, or you think your child might be eligible, then you would be referred to CS, or you could contact CS, and they will tell you what they need to start that process to determine your child is eligible for home and community-based services, as well as assist you with the Medicaid application. So now the next point we're going to go through is Medicaid managed care, and I'm going to turn that over to Hope.
Okay, great. Thanks, Colette. My name is Hope Goldhaber, and I am also from the New York State Department of Health. And I have a few slides here to give some basic information about Medicaid managed care for folks who may be unfamiliar. Managed care is health insurance. And what happens is the state contracts directly with health insurance plans to provide the Medicaid benefits for our Medicaid recipients. Of the over 6 million people in New York that are on Medicaid right now, over 4 million of them are in a comprehensive Medicaid managed care plan. This is not new. It's been around for quite a while. But for children, the services have been a little bit here and there. So one of the big pieces of the Medicaid redesign is to align the benefit under Medicaid managed care and make it easier for people to know if they're supposed to be in a plan or not in a plan, and how the services can be accessed. So most children already have a Medicaid managed care plan if they're in Medicaid, but some of the services may still be covered by regular Medicaid instead of their managed care plan. Some children do not have Medicaid managed care plan and get all of their services through regular Medicaid. In a Medicaid managed care plan, you have a primary care provider who works with you and your other care providers to coordinate the care that you need. The plan has a network of providers that actually work with the plan, and you choose your providers from those that have agreed to work with the plan. The Medicaid managed care plans also issue ID cards, so you will have a health plan card in addition to your regular Medicaid benefit card. And by having a managed care plan, you actually have another partner and resource in helping you find services and helping you get into services. So for children's services covered by Medicaid managed care, prior to July 1st, 2019, there were a lot of services for children and youth under 21 that were not in the Medicaid managed care plan benefit. And that was true especially if you were a child or youth who had supplemental security income, federal Social Security disability insurance status, or you were determined certified disabled by New York State Medical Disability Review. We call those collectively just children with SSI, just because those are a lot of words to say all at one time. But, you know, for these children, the services were not, there were a lot of behavioral health services, a lot of mental health and substance use services for these children that were not part of the plan benefit package, which meant you had to really rely on regular Medicaid and struggle to find a provider. So on July 1st, we did align the benefit. First of all, we brought in a whole bunch of services that were previously just not covered by plans at all for anyone under 21. And that list is on this slide here. You can see there's, some significant clinic services there, especially some of the OASIS services. And we really wanted to make sure it was easier for folks to find providers and to access these services. And not worry about, does this provider take the plan, does this provider take Medicaid, and if your child's status changes from being SSI to non-SSI, then all of a sudden all your provider choices changed, and we wanted to really eliminate some of that. And then the second piece here is the list of services that came out on the next slide for those that were carved out for those with SSI. And you can see those new CFTSS services that Meredith talked about earlier. They were part of the managed care benefits starting January 1st, but they were carved out for people with SSI. So now on July 1st, we've aligned the benefit across the board. There's no distinction anymore depending on just how you get your Medicaid. So I want to talk about what's happening in October. So we did get federal approval to enroll children who are participating in the children's waiver into managed care plans. And I'm going to go into this in a little bit more detail. But previously, children had the option to enroll in a plan or not, but the plan wasn't necessarily responsible for covering those services. Starting October 1st, children will enroll in the managed care plan, and the plan will be responsible for covering the waiver HCBS, Home and Community Services, for those children. We also got authority to have most children that are placed in foster care to be enrolled in Medicaid managed care, but that's not going to happen until 2020. So what does this move to Medicaid managed care mean? So in a managed care plan, you see the whole picture of a child's or youth's health care, including their physical health, social and emotional health, and behavioral health. It's easier to identify issues earlier on, and remember, a goal of this redesign was to try to access services earlier. You can get better results from your healthcare services because they're more coordinated, and like I mentioned, aligning the benefits under one insurance plan. And one of the advantages of being in a Medicaid managed care plan is that you do not have copay for most of your services. The only service that has a copay is pharmacy, and those copays are the same as they are in regular Medicaid. So our goal here is to make the transition for any child or youth who will have to enroll in October as smooth as possible. But a lot of the changes that have happened to put these services into managed care have happened behind the scenes. There's a lot of protections that we're putting in for children, and I'm going to go through some of those in a little bit more detail. So the first, and I think most important one, is that any child who is already in receipt of CFTSS, children's waiver services, or long-term services and supports, these are things like private duty nursing or personal care in the home. When you join a plan on October 1st, anything that's already in your plan of care stays the same. The plan is going to be working with your care team, becomes a new partner in your care team, but none of the changes that a plan might look to see about offering more services or changing some of your services are going to happen for the first 180 days. That's a full 6 months. Most of these transitions we do for 90 days, but for children, we doubled the time. Children will have access to the same provider, same service for the same episode of behavioral health care for 2 years from October 1st. So if you're already in a relationship with a behavioral health provider and you're newly joining a plan, you're not going to have a disruption in that care. Though the provider does need to agree to work with your Medicaid managed care plan, they don't necessarily have to be part of the network, but they do need to agree to follow the plan's rules to continue to see you. There are other protections that happen for anybody in regular Medicaid who's transitioning to managed care, and some of them I think are important because we see some of the questions that children and family have been asking. So one of them is, what happens to my prescriptions? So there is extra time to transition prescriptions. So if it just so happens that you pick a plan that does not work with your pharmacy, you get at least one fill at that pharmacy while you figure out how to get all your prescriptions transitioned to a pharmacy that works with the plan. There's a general protection that says if there's no provider within the plan's network that can treat you, the plan has to allow you to go out of network and see other providers. The plan has to make sure you have access to specialty care centers. And the Medicaid managed care plan is required to provide the same benefit as regular Medicaid, even though they may have different rules for getting prior approval or prior authorization before you get some services. So what do you really need to know? So starting in October, most children and youth who participate in the children's waiver will enroll in a Medicaid managed care plan. But there are some children that will not enroll because they're either exempt or excluded for a reason other than the children's waiver. Exempt means you can choose to enroll in Medicaid managed care, but you don't have to. Excluded means you cannot enroll in Medicaid managed care. So most exemptions are because there are individuals with special needs who are participating in programs that we have not developed the Medicaid managed care program for. Like Meredith mentioned, we've been working since 2011 to work on the Medicaid managed care program for children. So it took a long time to put those pieces in place. There are other groups and other 1915C waivers where they're not going to be coming into plan just yet, so they remain exempt. And there's other exemptions which are just like federal protections, such as those for Native Americans. Most exclusions where you cannot join a plan include individuals who already have private comprehensive health insurance or have Medicare, or people who don't have full Medicaid coverage. They're not eligible for the full coverage under Medicaid. They have only partial coverage. And then there are some exclusions because folks live in a residential scene that's operated by the state. And for most part, this is because there would be a duplication of services If you're in a residential setting, there's not a lot of care for a managed care plan to actually manage. So I have some examples that illustrate how this works. Today, Susan is participating in the children's waiver and is not enrolled in Medicaid managed care. She also has comprehensive health insurance through her father's employer. Susan is currently excluded from Medicaid managed care because she has comprehensive health insurance. On October 1st, Susan is still excluded and will not enroll in Medicaid managed care, but she'll continue to receive her waiver services through regular Medicaid. In my second example, Penny is participating in the children's waiver and is not enrolled in Medicaid managed care. She is certified disabled and gets full Medicaid based on her income alone. Other folks have called this family of one. Okay? Penny's currently exempt from Medicaid managed care only because she's participating in the children's waiver, which means she could enroll in Medicaid managed care, but up till now she hasn't chosen to. She does not have another reason to be exempted or excluded from Medicaid managed care. On October 1st, she will choose and enroll in a Medicaid managed care plan and will continue to receive her waiver services through the Medicaid managed care plan. To prepare for October 1st, children and youth participating in the waiver who are not yet enrolled in a plan, the state will check to see if there's another reason they're still exempt or excluded. There's a lot of these exemptions and exclusions we can tell just by looking at our records here. If we don't see that other reason, we will be sending a letter from New York Medicaid Choice. New York Medicaid Choice is the state's enrollment broker, saying it's time to choose a plan. New York Medicaid Choice can help families pick a plan. If the child youth participating in the waiver gets the letter saying it's time to choose a plan, you'll have at least 60 days to choose a plan. So now we know these letters are going out probably around this Friday. And that doesn't seem quite 60 days before October 1st. But I just want to guarantee that everyone will have at least 60 days to choose a plan. We want to make sure you have plenty of time to have this conversation about what plan is right for you. Your health home care manager or CS can even help you contact those that can assist you in choosing a plan. And once you enroll in a plan, you'll still have 90 days to change and switch to a different plan if one's available in your county if you want to. Once you've been enrolled in the plan for 90 days, you stay in that plan for 9 more months, unless there's a good cause reason to switch. Say you move to a new county and that new county, that plan that you're in doesn't serve that county, of course, we're going to let you switch your plan. You can call New York Medicaid Choice for help in choosing a plan and enrolling in Medicaid managed care pretty much at any time. There are certain things you should think about when you're choosing a plan. You want to know, of course, which plans are available in your county. It's probably a good idea to understand which doctors and providers that your child is seeing right now on a pretty regular basis so you can find out which plans they work with. You might want to talk to your providers and make sure they work with the plan that you're choosing. Like I said, New York Medicaid Choice can assist you in finding the right plan for yourself. The phone number right here is on this slide. Let's see. What do I call if I have a problem with my managed care plan? So you can definitely call the plan. Most problems that you have with a plan, the plan can resolve the fastest if you just call and let them know you're having a problem. You can also call the Community Health Access to Addiction and Mental Health Care Project line, or CHAMP, and you can call the New York State Department of Health complaint line, and the phone number is here on the screen, or email us. And there's the slide that Colette had promised with a whole bunch of other resources and questions and places and things to look up that can help you get more information about the services we're talking about today, and also more information about how to access those services and find out which plans are offering and how to get into Medicaid and all those kind of questions. So with that, I'll just say I want to thank everyone for listening today. If you have additional questions, please feel free to reach out to any of these numbers. And we look forward to hearing from you.